My name is Pete Tseronis, and I'm the CEO and founder of Dots and Bridges. I'm also the former Chief Technology Officer at the U.S. Department of Energy, the Department of Education, and frankly, a 25-year veteran from our federal service. I had an incredible journey and run during that time, and I've channeled that passion today and in the past and in the future to speaking with folks like Miss Lelia Jackson here, who you're going to meet today, about their journey and the impact working for the government, and in Lelia's case, the military, and it's having on her life. We're going to address today a number of topics. We're going to get to understand a bit more about the Veterans Health Administration. We're going to understand a bit about Lelia's leadership style and her values, but most importantly, we hope to shed some light on how technology and humanity and culture and United States Department of Veteran Affairs is taking shape. And in addition to that, we're going to discuss a little bit and hopefully inform and educate and enlighten you as to how this incredible department and Lelia's leadership is helping to advance that hope we have to tackle topics like COVID-19 and supporting our veterans now and into the future. So Lelia Jackson, friend and colleague, senior strategist to the chief of staff at the Veterans Health Administration. Welcome.
Thank you.
You look great, and it's so exciting to see you. And happy pre-Thanksgiving at a time where it's a unique time in our life, in our lives, unprecedented times. But it's really great to see you. Before we jump in, I can give a little bit more of a bio on this amazing individual in Lelia. She leads the administration's assault and harassment prevention efforts. In this role, she's been charged with systematically improving existing harassment and sexual assault reporting policies and post-prevention procedures. She was appointed to this role in October 2019 on the heels of completing a fellowship in the prestigious White House Leadership Development Program, where I got to first meet Lelia and her amazing colleagues. And she was the first from the department to be selected during the history of that program, if I'm correct. And prior to the fellowship, you were the director of the Center for Compassionate Care Innovation, where you led VA's efforts to explore emerging treatments and therapies to enhance veterans' well-being, which is, again, a very important theme for today's discussion. And I don't want to say most importantly, but boy, oh boy, a Marine Corps veteran with a strong commitment to service. Thank you for your service. I know that that's impacted you, and we'll talk a bit about that. She maintains a Master of Science in Technology Management, a Bachelor of Science in Criminology, as well as a pretty cool acronym, FACPPM, which is a mid-level federal acquisition certification for program and project managers. So she's pedigreed out, and she's phenomenally awesome. So how did I do, Lelia? Is there anything I left out?
Well, I do want to say that Dr. Michelle Dorsey and I were the two first to participate in the White House Leadership Development Program.
Roger that. And Michelle is amazing, and somebody who, by the way, I chatted with through email today, said I was super excited. So that being said, Lelia, can you, for the audience and for those who will be watching and tuning in, people think of the VA, the United States Department of Veteran Affairs. As I said in our pre-call, I did a little more research just for myself, and you think you know an agency, but there's so many organizations, but the big three: Veterans Health Administration, Veterans Benefit Administration, National Cemetery Administration. Those are typically thought of as the three core missions, but there is a fourth mission. Can you speak a little bit about the diversity of the agency and maybe hit on that fourth mission?
Yeah, well, thank you for that. Yeah, you're right. VA is huge and complex. For our veteran, we want them to think about VA. We don't want them to have to think about what is Veterans Health Administration? What is VA benefits? What is, hopefully they want to think about this, but cemetery. We want them to think, I want to choose VA for my services. And then they go to VA, they get their healthcare services, or they want a home loan, they get their home loan, or they want the GI benefit, or they just wanted to make an appointment with their mental health provider. We don't want them to have to think about discreetly Veterans Health Administration, Veterans Benefits Administration, because it's their VA. And that's one of the things that we've really worked on really, diligently on over the past several years. And, it's my VA. It's your VA vet. As a veteran, we can get our services at the VA. But you're right, it's a complex organization. uh, um, 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 but wonderful organization, I have to admit.
Yeah,
Yeah,
it's like a one-stop shop,
it
but
is.
you have to kind of still know how to navigate. It's not
You do.
like a DoD or a
Yes.
USDA.
Yeah, it's not. You do have to know how to navigate, but we have tried to make our technology a lot easier. When you go to our website, you can say, I'm looking for this thing. I'm looking for mental health services, or I'm looking for the loan. You don't have to go into Veterans Health Administration's website to dig down and drill down, because you lose people like that. If people have to drill down and drill down or drill down or call multiple numbers to get to where they want to go, most likely going to hang up. They're not going to keep looking. You're going to lose them. So, but you asked me about our fourth mission, which I am very proud of. Right now, these past 7 to 9 months have been just terrible for our nation. And I am so proud to be serving in Veterans Health Administration and VA in our COVID response. I mean, as you mentioned, we have Veterans Health Administration, Veterans Benefits Administration, our cemeteries, for our veterans who, pass on, and world class in all of those. But we have a fourth mission, and that is to help the nation in
Mm.
national preparedness. And this pandemic is a national emergency. And VA has provided healthcare providers and clinicians across the country to help our communities. We provide healthcare to veterans and their beneficiaries, but in a national emergency like the pandemic, we're able to provide health care to non-veteran U.S. citizen veterans. And we have done that for hundreds of persons in our communities. Our VA hospitals are nestled in communities. We have 150 medical centers, but we have community-based outpatient centers. We're all over the country. We're a part of the community. And so be able to provide health care to those in need, those hospitals that are at capacity, we've been able to provide care to those persons.
So if I can interject, because don't stop the
Yes,
thread, we're going to
definitely.
get into this COVID
Yes, yes, yes,
response. No,
yes.
no, no, it's wonderful. I want to just let our audience know the Veterans Health Administration, the largest integrated healthcare system in the United States. I'm getting this off the publicly available website,
Mhm.
providing care at 1,255 healthcare facilities, including 170 VA medical centers and 1,074 outpatient sites of care and varying complexity. VA outpatient clinics, VHA, to over 9 million veterans enrolled in the
Right.
VA healthcare program. So shout out to that mission. And that's, again, folks, just in the VHA. And if I could build off that, this is a budget in fiscal year 21 that has requested 243.3 billion with a B dollars, which is a 10% plus increase over enacted levels last year. And to your point, I also want to say that, this fourth mission, if you go to the website, don't miss it. I'm reading it right here. To improve the nation's preparedness for a response to war, terrorism, national emergencies, and natural disasters by developing plans and taking actions to ensure continued service to veterans, as well as to support national, state, and local emergency management, public health, safety, and homeland security efforts. And when I hear that, when I read that, Leila, I just think the VA is so much more than veterans. It is healthcare. It is homeland security.
That's
It's
right.
defense. You mentioned that it's a diverse mission, and the COVID response is something that, while it's horrible that we're having to deal with it, that partnership and working across the VA and leveraging technology and working with other agencies, how's that coming along?
It's come along great. And one of the things I want to give a shout out to our public affairs. We put out a lot of information about what we're doing, so it's not a secret. We want the nation to know what we're providing our taxpayers, what we're doing for our veterans, our constituency, but also for our communities. I mean, that is the whole point of the fourth mission, to be able to help the nation in time of crises, and to help the communities in which we live. I had the wonderful opportunity to, and as many, I don't know the number of VA employees who have been able to deploy across the country, but I had the opportunity, because I live in the DC area, to volunteer at the DC VA Medical Center during the pandemic. And
Wow.
it was one of the highlights of my career, to be quite frank with you. I was able to see firsthand how, our clinicians, our nurses, our providers, our medical center directors, I mean, the medical center director there is just a visionary, thinking about how do I improve care for the veterans, for whom I'm serving here at the VA in DC. And that's how they think across the country. I just happen to have the opportunity to work at the DC VA Medical Center. I was working in the command post, and we were fielding, the PPE equipment to the clinicians. We were making sure they had what they needed. We were responding to calls from family members. We were responding to calls from veterans. I took my COVID test. I'm concerned about the results. How soon can I get the results? Where can I get tested? We were answering those type of questions, and it was a 24/7 operation. And the folks came on duty. They were happy to be on duty. You could see early. I was there early when the pandemic kicked off, and you could see some fear in patient and clinician eyes as they came to get their equipment. But what surpassed that was their passion
Mm.
of continuing to take care of patients. I mean, you could see them day in and day out, just really committed to taking care of the patients there at the VA Medical Center. And you could see the confidence in the patients there getting their care. It was phenomenal.
Yeah, I'll tell you, you're hitting on a few things because I want to get into the journey of Lelia Jackson, because it's I hate to use the word now, it's infectious, but the manner in which you're just speaking, it's so obvious that the VA core values of integrity, commitment, advocacy, respect, and excellence, which if you look at that acronym, I care, that's you, Leila. I mean, I've felt that from the moment I met you to your ceremony, and here I am, and I think you're an incredible change agent and thought leader. And I want to emphasize that those who just heard that, we talked early in the beginning about how technology, humanity, and culture intersect, and the Mission Act, which is the maintaining internal systems and strengthening integrated outside networks. Read it, folks. You can Google it. It's a very important component in how technology is helping the mission of the VA and the VHA. There's the Program of Comprehensive Assistance for Family Caregivers, also known as the PCAFC. And again, I have to give a shout out to the Caregivers Records Management Application, CARMA. These are applications, to Leila, your point, that are being developed so that technology side of information sharing and automation, teamed with the passion, the human, press the flesh, hope people feel that we're here for you, is commingled. So I just wanted to go there because I think your DC VA Medical Center example is what the government's doing that not many people get to see. So I commend you for sharing that, or for doing what you do, and thank you. All right, I want to pivot now though to the awesomeness of Lelia Jackson, your journey. You're a pay it forward type of individual. You've talked about helping others in our prep calls, and your core values in the 19 years in the U.S. military or the Marine Corps.
20 years.
20. Okay, my bad. I had 19, but maybe I didn't round up right. But Leila, let's go back to that journey. What shaped you and your formation, and how it's led you to the government as the chief or senior strategist. Talk about that journey to the government.
Well, I reigned from a small town in South Carolina, Clover, South Carolina, and my father was a World War II Army veteran, and I knew pretty early on that I wanted to serve. I wasn't sure how, but my family is committed to service. They've always given to the community, always did things to help others, and so I knew I wanted to serve, and I met this amazing recruiter one day, like most high school students, and he was talking about all the great things about the Marine Corps. And oh, by the way, he did look pretty great in his uniform. And I thought I might be able to wear one of those uniforms. And so that's where my journey began. I did have an eye for education though at the time, and that's one of the benefits that the VA offers is. I didn't know how involved I would be in that now, years later, but I knew that I wanted to tap into the education that the VA, that the military offered. And so I joined the military and at 18, and had a phenomenal career. I was able to do a lot of great things in the Marine Corps, meet a lot of great people, work for a lot of fantastic leaders. In the Marine Corps, they start teaching leadership in boot camp.
Mm.
or in the officer candidate school. So you learn, or the basic school, you learn leadership is fundamental to being a Marine. You're always thinking about, even if you're a little, Lance Corporal, E3, you're thinking about, how can I lead my little fire team? You're always thinking about leadership. So that's been core of what I've done in the Marine Corps, when I was doing in the Marine Corps. And leadership has been very important to me throughout my entire career. Being a leader, but learning from leaders.
Before I have you continue, I just want to emphasize again that the federal government and its senior executive service core, it focuses on leading change and leading people and being results driven and having business acumen and being communicative in terms of verbal and written. And I will say that when I met you, and your just ability here to communicate is so coherent and lucid, and to be at 18 learning those leadership skills. Look, I didn't know what the heck I was doing at 18, other than I was in college figuring out, what am I even doing here? So I think that's so awesome on the one hand. And two, as you progress, feel free to share some examples of where that leadership in the Marine Corps, and then of course in the VA, when we get to that point in your career, really you were able to draw on that, because I think that's amazing and why you're a change agent today.
Well, I appreciate that. When you introduced me, you talked about my previous job at the Center for Compassionate Care Innovation.
Yeah.
I think being able to lead that effort was a culmination of my leadership from the Marine Corps, and then as I grew up in the VA around great leaders. I mean,
Mm.
I got to tell you, we have some pretty great leaders. I've been very fortunate to have worked around really great leaders, and even now, my chief of staff, my leadership allow me the autonomy to be able to do what I do, because I understand the bureaucracy, I understand the rules, but I have the freedom to be creative and leverage, coalitions and partnerships in VA and across government. I've been really fortunate, not just in VA, but in my career. So I will say, though, in the Center for Compassionate Care Innovation is an example of doing something very new at the time. That office explores emerging treatments and therapies to help veterans who have not responded to previous treatments. And one of the
Mm.
things that we did in that office is for a small segment of the veteran population who not responded well to traditional treatments for PTSD and other mental health conditions. They were able to, if they met certain criteria, of course, were able to get a service dog or the service dog benefit. And that's a big deal, because traditionally in the Marine Corps or in the VA, a veteran can get the veterinarian benefit for a service dog if they have a physical condition, visual,
Hmm.
hearing, uh, um, you know, those
Audio.
type of conditions, right? But not for a mental health condition. But
Wow.
what we heard from the civilian, from our veterans, from our veteran service organizations, from even Congress, is that, you know, veterans have told us that they believe that a service dog will help them, and some of them who didn't have the benefit were already getting service dogs to help them navigate. And so the VA opened up the policy to allow those veterans who met the criteria to get a service, get the benefit for a service dog. And what we heard was some just anecdotal feedback. We heard some veterans say, I never went to group therapy,
Mm.
until I got the dog. I felt like I could go navigate the space to get to my appointment. We heard other veterans who said, this service dog saved my life. I
Oh.
mean, we heard those type of anecdotal, and while it's not, widely open, if you can help one veteran, that's huge, especially a veteran who's served this country and given so much.
Yeah, I'm hearing this. And again, what I love about these conversations is there's no script as we discuss. It's kind of to get the conversation going and telling stories. And those are stories that again, if you're hearing this and listening, we're talking about the human beings and canines and how we learned that it's not just the audio visual accessibility need, but the mental health, which is
Right.
so, we think, oh, that's post-traumatic uh, syndrome. I don't, forgive me for not maybe saying it properly, but we all are dealing with stress and mental
Yeah.
matters today, just being in COVID. So thank you for sharing that. And again, I have to believe that, looking at and having worked in the world of technology and folks, Miss Leela likes to act like she's not a technologist and a techie geek, but trust me, she knows the impact technology has on her mission. And I think that's something that if you can speak to, hey, you have a group, you have a CIO in the Veterans
Yes.
Affairs department. You know that there are folks that come to work every day and are writing code, and there are folks calling on the agencies. Can you just at a high enough level talk a bit about if you're, somebody saying, where do I start? Is there a fabric? Is there a tapestry that's horizontal where, hey, Leela, you're up in the Veterans Health Administration. Our good friend, Mr. Craig Lugart and Dr. Joe Ronzio are the Chief Health Technology Officers. Is there a communication across the department where at least needs and requirements and technology solutions kind of can convene?
Absolutely. I mean,
Okay.
I think one thing, I would love to just put a shout out is that I think people should take the time to do their research about our mission, about what the VA is. VA is complex. So I think, on the outside, I really hope that people will pause to really understand Veterans Health, VA and then Veterans Health Administration. Um, is, one of the great things I can say, and I know this firsthand, is that our CIO and our Veterans Health Administration executive in charge leadership
Mm,
talk.
wow.
It's not, there's not a silo. They communicate, and it's a partnership. And that didn't just start. I mean, they understand that we have requirements, and they, our OIT, our colleagues help us get those, bring those requirements to fruition. So it's huge. I think we take it for granted in Veterans Health Administration that the IT colleagues are going to help us. It's just, it's part of the fabric. It's what we do. We know we don't have to wonder, will OIT be there for us to help us get this done? I mean, think about it. I was just thinking as I was preparing for this conversation, I was thinking about, I don't know, it's probably been 8 years maybe or so where I was working on this major initiative called the Veterans Lifetime Electronic Record, VELR.
There
And I
you
was a
go.
part of
See,
that.
your geekiness is coming out, lady. So don't tell me you're not a techie. So roll with that.
Well,
That sounds interesting.
at a high level, but I was a program manager helping bring all those parts together between VHA and OINT and veterans benefits. The whole. I was at a higher level. I was putting that fat PPM to work.
Okay, so
Uh,
let me just
yes,
jump in there, but go back to that because to
yes,
me, coming from the federal government, I was
yes,
the connective tissue officer. I called
yes,
myself. I was a CTO, but I knew my job was to knock on a door. If somebody was in a bad mood, I still was like, "Can you come to this meeting? We're talking about we need tech to support this type of information that
yes,
needs to be aggregated."
yeah,
You seem like that's just your DNA, which is bring people together,
yeah,
get the right people together. And I think
yeah,
if you can talk a little bit more about how do you plow through that? Because again, I do think our industry counterparts, and in the spirit of tech humanity culture, and nobody's going to argue that the VA and the VHA aren't all in on tech and spending money too. But
right.
we in the government, Leela, you know this, we spend $90 billion a year on IT support and services. And sometimes, or most of the time, that's to keep the lights on. And it takes, I think, that let's get the right people together to see how we can advance this pendulum. So, do you have an experience where getting those people together actually moved that needle to the right, or what it took to do that?
Honestly, I think it has started for a long time at the top. Our VA leadership insists that they're at the table together.
Mm,
And because that's been happening for so long, there is it's integrated. It's
mm-hmm,
not a we they situation, it's
mm-hmm.
us, it's a team. And it's not just, at the CIO level. I'm working on a project. I'm working on a project now in the Assault and Harassment Prevention Office. I know that I cannot have a paper-driven process for a system as big as VA. We have to automate. We have to use leverage technology to be able to do just the fundamental things of our day-to-day jobs.
So break. Here you go. You've used a word like automate, and I'm going to go back to the caregiver records management application, and it's the
Yes.
first expansion of again I'm going to use the acronym if you don't mind, the PCAFC, effective October 1, 2020. eligible veterans injured in line of duty on or before May 7, 1975, there will be an on-ramp, if you will, or an automated manner for those folks to connect. You're doing to me, or you're explaining to me what I loved about my time in government, which is it's not like the IC or the CIOs and the IT people know every requirement out there.
Right.
Here are you, Lelia, right now, today, or in that time when you served in some of your prior jobs as director for Center for Compassionate Care and Innovation. You know what you need better than the technology people, but it is bringing together and saying, I want to be a part of that process. So back to your example, how did you bring together, or when you identified, we got to get away from this manual processing? What's your first thought? Do you call the CIO, or is it, do I call industry? What do you do?
Well, for me, I am in Veterans Health Administration. I'm in the Chief of Staff's office, so I have a view across the department. View across, and I've been in VA for a number of years now. You call who you know. I know to call
Sneakernet
guy, but it doesn't. I mean, it's so easy. As if I don't know, I just ask the question.
Yeah.
And that's what's really great. You don't have to know who to call, but if you got to know to call somebody.
And does this go to your, hey, industry? And if somebody gleans from today, there are requirements that are organically born in a process that somebody like Lelia Jackson is saying, gosh, I wish we had something that did the following.
Yeah.
I hope people take away from today, at least they look at VHA, some of the information you talked about, looking at these CARES Act, because, hey, industry, we all know you can provide really cool technology and support, but applying it or commingling it to the mission, as you said earlier about homework, engage in a discussion. So that speaks to your, I think, partnership, building trust. I'm going to break this down to a humane level here. What in your time in the Marine Corps, to your role today, to what you had in leadership, you and I've talked about this, Lelia, the power of trust and cultivating trust, whether it's with industry or your coworkers. How important is that to you?
Huge. We, people may think it's, we're taking it for granted when we say trust, but we really mean it in VA. We want our veterans to trust VA. We use language like choose VA because we really want veterans to choose VA. Trust is a huge, and you can break trust. So we work hard every day to let our veterans, our stakeholders know that we're serious. We work on increasing the number of veterans that receive care every day. We spend a lot of time on the veteran experience. We do use technology and AI to understand what does the veteran want. We do surveys. We do regular surveys after a veteran comes from his appointment or her appointment. I'm a veteran, and I have even received those emails or text
surveys,
messages
questionnaires.
asking, hey, how was your appointment? Give us feedback. We care about that. We invest a lot of money in technology because we want to reach our veterans where they are. As I was thinking about that today, I was thinking about just the bandwidth, getting access to the internet in my hometown. Sometimes the internet is a little bit spotty because I live in a little small rural area. And we have millions of veterans who live in rural areas. And to me, that's one of the things that VA does well is we try to reach veterans and provide access to care to veterans, like those millions of veterans are in rural areas. We just, speaking of partnerships, last year we created have a new partnership with Microsoft. I don't know if I can say the name, but with an organization to improve the quality of access, bandwidth, broadband, or access to internet, so that veterans who don't normally have access to the internet can do their telemedicine appointments. They can, whatever services they want to see online, they can get them or they can see them.
Well, I'll tell you, you hit on a few things. Rural broadband infrastructure.
Yes.
We know that here on the East Coast, I have to admit, I live in Montgomery County, Maryland, and we have more bandwidth, at least in my zip code, and more malls and restaurants. But when you look at the map, and I'm very passionate, I was fortunate to work in the telecommunication, my master's degrees in telecommunications. I remember doing a study in 96 on where there wasn't broadband. And honestly,
Right.
Lelia, you nailed it. Today, the map looks kind of similar in some places. And that's a great, oh my gosh moment. Thank you for sharing. But precision medicine, telemedicine, it requires broadband today. It
Yeah.
requires infrastructure. And as you say, that's to me where it's not always about putting more technology out there, but having a purpose for that technology.
Right.
So that is something that when I think of technology to support the caregivers, to support the folks in need, I had a light bulb moment. So thank you for that. All right, we're coming close to the end, and I know you have to come up with a cool parting shot, but there is something I do want to ask, and maybe I hope this isn't considered a hardball, but when I see the FACPPM acquisition certification program, I do recognize as a techie myself that the technology sometimes is a little bit of a challenge to bring into government, and that acquisition sometimes is deemed sort of the long pole in the tent. Can you talk, not that it is, by the way, but what does that certification mean to you, and why did you pursue it?
I really wanted to make sure I understood how to get acquisition done, and at the time that I started pursuing that certification, it was a little bit complex. We were doing a lot of acquisitions. It was, a few years back when I started that journey. It was, we know that, technology, acquisitions, HR, those are, if you're missing out on one of
Right.
those, you got to,
Yeah.
it's a perfect storm to disaster. And so I really wanted to make sure I understood it so I could get things done quicker, and has been very helpful for me.
Well, that's a great answer. I wish I had served some time in that. I always wish if I went back into government, I'd want to spend about a year in acquisition, maybe a year in budget,
Yeah.
because you're right, the government is very, or not you're right, but I'm saying that the silo effect is in play, and you clearly are a horizontal connector. You are a dot connecting bridge builder, lady, and I love it. Okay, and not to mention an influencer. So folks, get to know or at least read about this amazing individual. Leela, I like to finish with sort of, we touched on a lot of topics, what the VHA is, and there's so much more we hope people can research, your journey, serving our country, leadership, partnerships, trust. So thank you for being able to consolidate that. And I know there's so much more we can address, but what's something you'd love to leave with anybody watching this, from Joe Sixpack to some leader of a foreign nation to the good folks down in Clover, South Carolina, as to why you're so passionate about serving our country, both as a civilian now and obviously, impressioned by your time in service?
It's a gift. It's a gift to be able to work for an agency that has some of the smartest, most innovative folks in the nation. I mean, we get to serve the American people by providing care to our nation's veterans. I mean, I just can't imagine. I mean, I know there are a lot of great missions across the government, but I am just so honored to be able to take, to do my little part of serving those who have given, so much for this country. And having served in the Marine Corps, to be able to continue to serve in such a great organization, uh, it's a gift. And so I would leave a couple things. I would ask our persons who know veterans who might not be enrolled in VA healthcare or getting their benefits, ask them to do that. It's important. We have 9 million veterans enrolled in healthcare. We have 20 million veterans in the country.
Oh.
That means that we want those veterans to come to VA.
But let me finish with this. I want to thank you on two fronts. One, for educating, informing, and enlightening me. It's a gift to be able to interview you. I believe you will do the same for those who watch this. I also appreciate how you eloquently talk to technology affecting humanity, influencing culture, which shapes that technology that, at least at the VHA and those exemplars you shared, it's living and breathing every day of the week and twice on Sunday. So thank you for being on the show. Until we meet again, you're an amazing influencer, and I'm, again, blessed to know you. Thank you.
Thank you, Pete.